So I'd say my first tip is sleeping in a recliner. It's really hard to lift your body and your neck. It puts a lot of strain. Everything's connected to your spine, as you probably already know if you've been going through an injury. And everything you do fucking hurts. So sleeping in a recliner keeps you more upright. It helps you expectorate any mucus that you might have gotten from the intubation. And I definitely have that. It's hard to swallow. So it's also hard to clear your airway at first. I have to make a conscious effort to make sure I'm swallowing even liquids alone properly so that I don't choke and, drown myself in my own fluids. So there's that fun thing. I'm also being a pretty good little patient, and I'm using the inspirometer like I should. You suck in with it and keep it between the lines and try to get as high as you can. Every single time I give it my best effort, and it makes me cough. And I guess I know that's how it's working. It's opening up all those alveoli that could have gotten, closed up during surgery from not breathing normally. So it's good to do that. Also, I am propped up on pillows in this recliner, and I have one under my knees. I find that it's really helpful to keep pillows under your arms because your shoulders are taped down in the OR in a very strange position. Your head is put into a metal halo and has screws in it, and then it's weighted back and pulled back. And so all of the muscles in your upper body are going to ache enormously, really bad. It's like painful body aches. As a woman, obviously I'm not wearing a bra right now. So what I did do is made sure I have plenty of button-up pajamas. So button-up shirt with a button-up shirt with either shorts or pants. You are given a urinary catheter during surgery. That really freaking sucks. I am a pretty modest person, and it really ekes me out having people mess with my junk. And so I requested that sucker be pulled immediately after surgery and before I woke up, because I'd rather just not know about it. And both times that I've had this surgery, the first time I was fused C3 to C5, this time getting the rest of the spine, the cervical spine fused. Both times as a girl, you're sitting in a chair, warm, dark places. I've gotten a UTI and a urinary tract infection and a yeast infection post-op from having the urinary catheter in, even though it was pulled fairly quickly. But a lot of that comes also from being pretty sedentary, and that's despite sponge bathing before I've been allowed to. You're obviously not supposed to have a shower for 4 to 5 days post-op, but that doesn't mean you can't clean yourself up with a washcloth and change your clothes frequently. And despite doing all of those things, I'm still suffering from the downtown mess. So be prepared for that. Get some cranberry juice in your fridge. Grab some Azo ahead of time. That helped me. It was helping me. TMI, I guess. And getting up and walking with the walker helps stretch all those muscles. You're going to be on pain medication, obviously post-op. I take mine every 4 hours like a champ. The opioids make me sick, so I also asked for ondansetron to help with the nausea. And it also causes urine retention and constipation. So in addition to all that fun thing, I also added in stool softeners and Dulcolax to help things keep moving. It took me 5 days before I could have a bowel movement after being on the opioids in the hospital. And part of that is probably because I don't want to do that stuff in the hospital. I just wanted to wait till I got home. And then I also have Chloraseptic throat spray that helps a lot. Cough drops. If you make sure you don't suck them down your throat, because you can cough and choke. Everything can make you cough and choke. I also have my gabapentin, which I take in, if you see over there, I got a little stash of pudding or like gelatin. I found that taking the larger pills in either a pudding or gelatin helps me slide it down easier than it would in just trying to swallow a pill in liquid alone. So that's another, I hope, useful tip. I've been eating a lot of soft foods that are pretty meh, but have felt pretty good going down. Things that I can tolerate. So nice, easy, small things that people can make for you, because everybody's going to feel like a burden the first few days. Like, you can't do anything yourself. Even sitting up is hard. So I got my Velveeta teeny tiny noodles, mac and cheese. I've been doing a lot of instant mashed potatoes. That helps. Other things that I was able to get down were non-breaded fish fillets that were baked in the oven. They're nice and soft. So fish slides down pretty easy. Shredded rotisserie chicken. You got to chew everything really, really well. I've stayed away from most hard things like crackers or chips or bread or cereal or any of that. But obviously oatmeal, another great choice. Yogurt, drinkable smoothies. They help, but the mucus from the surgery gets exasperated when I drink milk products. So I've actually kind of stayed away from smoothies that have milk or yogurt in them at this time. I'll probably do some of that later as I start to feel less goopy. Other options, I'll make sure I have tissues nearby because I'm coughing crap up and you can choke and die. Fun things. And getting up and walking, making sure you do that frequently really helps. Ice pack or heat pack for your muscles on your shoulders, not on your incision area, but definitely for your sore muscles from being taped up intra-op. That has definitely helped. You can tell my hair is still braided from surgery. I went to the hospital in these braids and I'm still gross. I probably still have blood from the halo in surgery on my scalp, because they do strap you into that, and then they put plugs into your wrists and your ankles to test your spinal cord for function during the entire surgery every 15 minutes. So I have small scars or puncture wounds from that. They go away, but it did leave like a permanent freckle after the first surgery. So they knew exactly where to go the second surgery, I guess. They had landmarks. What other things can I say to help you guys out? Oh, chapstick and lotion. You obviously can't have that stuff going into surgery, but when you come out, everything feels dry. You're on oxygen and stuff. And you can't lick your lips or anything. And so your mouth and your face feels incredibly dry. So all you want to do is just wash your face and put some lotion on and get some chapstick on and make you feel more human. The braids obviously kept my very long hair out of the way of surgery during the operation. So if you're a girl with long hair, I hope this helps you out. Braid it, either in single braid or double braid, because I was trying to be cute, I guess. The nurses were really happy about that. Another tip I had going in pre-op was that I shaved my arm hair because, as you can see, I got bruises everywhere from where they hit me trying to get catheters in. I'm not the most easy stick in the world, but I had several catheters, and the tape just tears my skin up. And I learned from the first time that when you take that tape back off, it freaking hurts almost as much as getting stuck by a catheter. Actually, more than getting stuck by a catheter. The tape coming off is a bitch. I definitely recommend shaving your arm hair, even if you don't have arm hair, even if it's like light and blonde, like mine was. Shaved it all off, so I didn't have to deal with trying to pull my own hair off while I'm taking the tape from catheters off. That made things a little bit more comfortable. Shoes. Bring slip-on shoes. I have I don't know if I can find my shoes and show them to you, because it's hard for me to sit up on my own right now still. My collar, I just learned to adjust to keep comfy, but I have these slide-on slip shoes that I used in the hospital. Nobody wants to touch a gross hospital floor. It's like MRSA. No thanks. And it's good to have those on for stability when you're walking around your house too. It made me feel like, I don't have carpets in my house, so it made the walker a lot easier to use. But slip-on shoes. Anything slip-on is good. Yeah. And other ideas on what we did to make things easier. Chloroseptic spray, went over that. Pillows, I don't know. As it comes along, I will just update you. I guess how I'm feeling today, better than I did in the hospital. I had a couple of really bad nights. I haven't gotten a full night's sleep yet. In the hospital, I cat-napped only like an hour here, an hour there, 15 minutes here or there. Now that I'm home, I'm getting a few hours at a time in between pain medication doses. Still setting my alarm to make sure I get up every 4. And last time I did this, I was able to wean off of opioids within a few weeks. It wasn't that bad. But it takes a long time to heal, so don't rush it. Move at your own pace. I know that tomorrow I will be getting a shower and changing this dressing. And that is going to make me feel like a new person. Getting my hair washed and put in a ponytail is going to make me feel great. I know that when I'm eating, sometimes removing the collar can be scary. So I put a washcloth in here and just put it to keep this thing clean. Because when you take a shower, you can remove your collar. Your C collar can come off. But if you're eating with it on, it can get gross. So literally, I just take like a paper towel or tissue. And if I'm eating something and I'm afraid to get it gross, because you're stuck in this thing for, weeks. The last thing you want is old food stuck to your face. So just pull a little quick bib situation and you're good to go. Bendy straws. Oh, how could I forget this? Soup, everything. I'm drinking it in a bendy straw so that you don't have to worry about getting a spoon to your face and jiggling it all over yourself. This is coffee, by the way. So that is a good tip. And getting the back support, right? Sometimes just adjusting in the chair is painful. I'm pretty sore. I'm hoping that tomorrow I'll move around a little bit more. I knew last time that I went through this, it took me about 5 or 6 days at home before I could move and get up on my own without a walker. We'll see how it goes this time, now that I'm like a veteran. And I'll update you guys as this progresses. So I'm hoping this helps somebody out. Signing off.